The cancer rates right now in our pets are 1 in 4, and it's 1 in 2 over the age of 10. Hello, and welcome to the Coaches Collab. We are happy to have you here. I am Holistic Pet Health Coach Melissa Natanson, and before I introduce you to who our guest is today, we had a little switcheroo. Our guest was supposed to be Kat Johnston. She is a vet tech and holistic pet health coach. I promise she'll be coming back later, but she had a little bit of an urgent situation that she had to jump out of. So it really took me back to my reporter days, like anchor on the spot, change the story, here we go. So guess who the change is? I'm so excited. We had Miss Sandy Reynolds, a colleague and holistic pet health coach, who jumped in to help be part of this wonderful conversation today. I so appreciate it, Sandy. How are you?
Happy to. Excited to be here. It's a Friday on a long weekend. I'm sure everybody's glad to see today come.
Yeah. One of the things that Kat and I were going to talk about today, and it's just as important any of us can talk about it, is the importance of and the value of having a holistic pet health coach. I think that one of the things that I mention often when we're doing this show is the epidemic of pet health issues that we're facing and really why our position was created. Sandy was one of the original pet health coaches and one of the first ones to take Dr. Ruth Roberts' program. So she's got a lot of insight here. And I want to hear that. But what I usually say is we are here to bridge the gap between veterinary care and pet parents. And there's a lot of reasons for that. We talk often about vets know what they know. And more often than not, their training is geared towards treating symptoms. Whereas holistic pet health coaches, we look at the body as a whole and see how would the environment be affecting a dog that has IBD or is having stress colitis? How would the diet be affecting a pet that has been diagnosed with kidney disease? What supplements would benefit a dog that has a heart murmur or mitral valve disease or any kind of cardiac thing or Cushing's? So that's what Sandy and I really want to talk about today is where our skills are at and how we can help you, pet health enthusiasts and pet health parents, on what we really do. So before we pull in with Sandy, I want to put a couple of questions out there. These were questions that we want your feedback on. You don't have to answer now, but we'd love to hear with you, and we'll put them back up too. So who do you go to when you have questions about pet nutrition or pet food? What are your resources now? Who do you go to? This is something that when I was first overwhelmed with everything that my own dog, Darla, had going on, I didn't have a guide. And this was really something I ended up having to figure it out on my own, but I don't feel there's a resource for it. So I want to put the question out there. Who do you go to? Another one is, what would you like to save money on in veterinary care?
Everything.
Yeah. This is something that we're going to talk about is how we can come in and, for example, if you have a dog that is getting monthly Cytopoint injections for skin issues, Sandy and I have been trained along with our other amazing holistic pet health coaches to look beyond that, which is in essence, it's a monoclonal antibody, can just mask the symptoms, but we never get to the root of what's actually causing the issues with the skin in the first place, usually linked to gut. And the last question that we want to ask as you're thinking about it, that's not the question, that's the event, is what conditions are affecting your dog or cat the most? What are you seeing? So Sandy, that's where I want to bring you in, is in your holistic pet health coaching and in your journey, what are some of the things that you have seen the most?
I really see skin allergy type itching stuff probably the most, but I get a lot of referrals off of the clients that I help. So I think that I seem to be pooled for that. But it's sad to see how many people do have their pets on Cytopoint injections or, prescription type of treatments that are just masking the problem. The pet still has the underlying issue. But when we come in and we can clean up that gut, get them on a whole food diet, and you're not having to spend the money for the vet visits and or the injections or the prescriptions, and ultimately the pet feels amazing. I love the before and after pictures, and I think that when people see what can be done with food, that's we can't speak any higher than that, because picture says 1,000 words.
You had a great picture that you were able to show us a couple of weeks ago of a little client that you had, that the difference in the skin and the weight was amazing.
Yeah. So a little Corgi Pit Bull mix. She was 39 pounds and so overweight. She didn't want to walk even 10 feet. She would lay down. If you put even a leash on her, she would think she just expect you to drag her. She couldn't jump on the bed, the couch. She was just a little couch potato and expected to be lifted everywhere if you wanted her somewhere other than the floor. And in about 3.5 months' time, with just diet change and watching what treats were given, she lost 8.5 pounds, and she literally looks like a whole different dog. It blows your mind. And the pet parent was just in shock, because I do have them take the before pictures and then I ask for after pictures, and they don't remember a lot of times what they were looking at or what they were dealing with or the severity in the very beginning, because obviously as it gets better, it's less of an issue for them when the pet is feeling better. But when you truly do have those before and afters that you can be reminded of, oh my gosh, we were here and we got all the way to here, and we did it with healing the gut and whole foods. It's mind blowing, really. I get goosebumps when I see them, and I'm so excited, especially for the pet, because we're their voice. They can't speak. They can itch and they can chew their feet and they can do whatever to try to tell their pet parent or whoever cares for them that I'm in pain or I'm really itchy or my gut doesn't feel good. But when we can do that and help them, it feels so good. And I want to shout out to everybody. Everybody can do this for their own pet and put the power back in the pet parents' hands. Yes, you need your veterinarians, but if you build your team, and I know we've talked about this many times, you may need not only your vet for diagnostics or prescriptions and certain things that we need, but if you have your holistic pet health coach or nutritionist who can help you with the diet, get to the root of the issues, you may need an animal communicator, you may need a chiropractic person. We've talked about this. Build out your team for what your pet needs, ultimately keeping them healthy. You are going to have less vet bills. You are going to save money. And in turn, the pet's going to live longer and feel a lot better.
Yeah. I think, well said, Sandy. And I think one of the things that we concentrate a lot, being holistic pet health coaches, one of the things that we concentrate on coming from our background. And once again, our background, and Sandy, feel free to add anything. Our background in our training through Dr. Ruth is in functional medicine. It's in the body as a whole. It's in how supplements can be incorporated to support whatever condition is going on, in addition to traditional Chinese veterinary medicine that gets brought into. And we also look at environment, stress. What is going on with this pet's brain? Is it stressed constantly? Is there environmental things? Are there plugins in the house? Is there a new spray? Is there a new laundry detergent? So often, I'm not even gonna say so often, I feel like 100% of the time when your pet is experiencing a symptom, it is rare that it is from one thing. So what I mean by that is, take Sandy's example with, we've got a little dog with skin issues. Is the skin issue solid and isolated just with, oh, we've got one hot spot? No. And I'm going to go back to what I say so often is, the skin is our largest organ. And so if there's problems going on in the guts or the immune system, one of the first places that we see it is in the skin. If there's food intolerances or other things that are coming out like that. So that is part of the value of a holistic pet health coach. So say you've got a hot spot or a skin issue, and if we don't get to the root of what the trigger is that may be causing that, or if there's a gut imbalance, if there's kibble involved, which adds a lot to the inflammation, that's overall systemic inflammation, that's where we can come in. And not only are we bridging the gap between veterinary care and pet parents, but most of all, we're here for the pets. We want to get your little pumpkins some relief.
Absolutely.
I think that's one of the biggest things. Yeah. Okay, Corinna, we see your question and we will definitely go in there. So when Kat and I were talking, we were talking a little bit. Kat is a vet tech, and she's had a foot in both worlds. And she was talking about the major, I would say 4 to 5 major things that she sees. And number one for her that she's seen, she's in Texas, is obesity, generalized obesity in pets. Number two, allergies and skin issues for sure, thyroid and cardiovascular disease, cancer. The cancer rates right now in our pets are 1 in 4, and it's 1 in 2 over the age of 10. Those statistics,
It's so scary.
yeah, those are a bit too much to handle. And of course, urinary. She mentioned that urinary issues are a lot too. So, Sandy, fill us in from a pet health coach perspective. If you had a client that was coming to you with urinary issues and a pet on kibble, what are some of the first things you would say to them?
Get rid of the brown burnt balls, right? We'd want to definitely switch over to a whole food diet. And for some people, cooking may not be an option. And I like to train in that with my clients, obviously. I think I've got it down and it's very easy for me, but I don't want people to be shy away from getting help or thinking that's the only option. If you want to purchase foods, we also help you find that option. You can do raw, you can do gently cooked. We're not a one size fits all. We do what is right for your pet and your home and situation. So always know that we are going to look at every aspect and take into account what your goals are and what you're hoping to achieve and what your budget is, those kind of things. So getting them off kibble for one. Then there's also some natural supplements that we can also do to support the bladder, things like that. Obviously, it takes a whole consult to dive in and see if we have any other issues with other organs or things going on. But from a healthy standpoint, the first part is the food. And I know that we say that over and over again, but just like you were mentioning about the little dog before that had lost so much weight, the inflammation that goes down, and that helps the whole body. As you were just saying, obesity is one. I think a lot of people feel bad for their pet if they have to go to work and they leave them home alone. And so they overcompensate in giving them excess treats or leaving food out because they think that they're lonely throughout the day. When in actuality, it's more harmful to the pet because then you can have more joint issues. They can have tendon, ligament problems. Depends on the kind of dog because some breed dogs have longer backs and they can injure their backs if they're too heavy. There's a lot of aspects that we can look at in doing that. And if a pet parent is open to changing the diet, that weight usually comes into balance on its own. Honestly, the inflammation starts to go away. The pet feels great. They're getting all of the nutrients that they need to feel good and healthy. The energy level that comes back to pets that are taken off of sometimes really high carb diets that doesn't suit them or their metabolism. It's just beautiful to see. I love getting videos. People text me all the time, pictures or a video of, oh my gosh, look, they ran at the park this time, or just something new that's a milestone they haven't been able to do in a long time.
Yeah, it's amazing. It's amazing the changes that I have seen in just 2 days of a clean diet, from switching over from kibble to a clean diet. I have seen dogs have relief from itchies in a couple of days. Does that happen all the time? No. Is it sometimes a process? Yes. But what I always like to emphasize on is I feel like we're always so big picture. And when we get right down to it, the changes that are made, they may be big changes, but they affect the small stuff that affects the whole. And what I mean by that is the food that we eat, just like the food that our pets eat, this is what's providing the energy for our cells to do everyday tasks, whether it's changeover, whether it's to divide, whether it's to
Fight
pull in.
cancer.
Pardon me?
Fight cancer.
Yeah,
If
exactly.
you have a dog approaching senior years and they're now in that 1 out of 2 category of being possible of developing cancer, the healthier they are and the healthier their diet is and their cells can fight, hopefully we can keep cancer away from them.
Such a good point, Sandy, because really what you're saying is what we eat is the blueprint for how our cells replicate and how our cells take care of each other. So, once again, not shaming if you're feeding kibble, but our encouragement is always to freshen up the kibble, whether if it's with whole foods or with toppers or things by that, and eventually get to whole fresh food, because that whole fresh food that they're eating is, number one, more bioavailable for their system to use. So that means that we are powering their cellular energy. And when cells are powered, then organs are powered. And when organs are powered, then the entire body has a chance to be on the pathway to health and has that foundation set for being healthy
Absolutely.
and has the chance to heal.
I think of pet parents, like I mentioned just a little bit ago, I think pet parents feel guilty. I've been there myself. We all, whether it's your kids or your pets or whoever, if you don't feel like you're able to be there or to do certain things or whatever, you do overcompensate. But we have lots of ideas as pet health coaches for enrichment, things that they can do while you're at work, not involving leaving out high carb snacks or just different things like that. So the fact that we can just do so many different modalities and have ideas for you to be able to help that pet with anxiety or boredom or all those kind of things. I like that part about what we do because we come at it, like you said, from the whole animal perspective. We take into account every part of their life and how we can help them function and feel their best.
Yeah. Once again, emphasizing that we really want to get to the root of this. And also a reminder, we're not vets. We can't diagnose and we don't treat, but what we do is support.
Absolutely.
And we support nutritionally, environmentally, with supplements, and we also act as that guide. Sometimes the relief that I hear from some of the people that I'm working with, oh my goodness, I didn't know any of this. I'm so glad I do. And I know, Sandy, you were just saying that you've been there. Think back to when you were struggling with your little one. I remember when everything first went down with Darla. And just side note for new listeners today, welcome. We're so glad to have you here. But I talk about my little gal, Darla, often. She was a rescue. She was living off of trash and then was in a rescue on kibble. And it was really traumatic for her. We take that trauma into account now because the trauma of her rescue set the stage for a lot of gut issues later on. The gut brain axis is significant and crucial with so many pets. And little Darla had bleeding ulcers in her stomach. And one day she started vomiting blood and aspirated the blood, and we almost lost her. And that's how I figured out the massive amount of problems that she had going on. And excuse me, the prognosis was not great. And I literally had to figure out what I was going to feed her, or she wasn't going to make it, because she'd also done an intolerance test and everything came up. And maybe but I know everyone's been there. The amount of times that I have just woken up in the middle of the night going, what am I going to do? What am I going to do? Crying, thinking, how am I going to figure it out? Sandy's been there so many times too. I think my point of this is we have been through the ringers so that you and your pet don't have to.
I think one of my favorite things is that because when pet parents come to us and they're in that state, they may be in a panic. They may have just gotten a diagnosis from their vet that's really scary and maybe not very positive, right? And they may be facing some tough challenges coming up in the future. we're level-headed about it. We can put your dog first, and we can develop a plan for you and help just hold your hand and get you going. Because when you are in the trenches like that, you are so worried, so upset, don't know where you're going to go. It's just easy if you have someone that you can trust just to help you step by step. This is how we're going to start, one day at a time. This is how we do it. And I love that about all of us coaches, is that we're very comforting and just so hopeful and positive. And the fact that we have the knowledge to back it up and just help get you on the way, it's just a great feeling. And once you get through that rough part and things are looking good and you can breathe again, then you're good. But to get there, we're here to help you with that.
Yeah. And I know I have accumulated my own supplement graveyard.
Me too.
You know,
I'm sure everybody has one.
And I so appreciate the pet parents that are just online looking stuff up. But if you were to Google good supplements for a kitty or a doggy with kidney disease, you're going to get about 100 at least. And there's a supplement for everything now. But part of what the holistic pet health coaches do, we're all in communication with each other. We are continuing education all the time. We vet and look at new products every week. We all have been through the supplement graveyard. We're going to rise up out of that supplement graveyard because we don't need it anymore. And we've tried and tested so many supplements. In general, works.
Yep.
Of course, we're not claiming to cure anything, but we know in general from experience a lot of things that can help, rather than just taking on this and let's bury another one.
And that goes into the research that we do for your individual pet, though, because we take so much into account when we are choosing and recommending something for our clients, because not every pet is the same. And what works for my dog might not work for their dog as well. And so that is something that I love to go down those rabbit holes. I love to do the research on different things. And there's always new things coming out that we can learn about. Just like you said, I don't think there's any of us that don't at least do 1 or 3 classes a week of some kind, if not some kind of a training that is several weeks or months continuous. So the fact that we can help you dial it in instead of you spending so much money on, let's order and try this one, it had good reviews on Google, whatever. Why not just skip to the chase and maybe try one that's going to better suit your pet out of the get-go, and not spend $100, $200 on 5 other things that maybe don't work.
Absolutely. Because we've been through it, and knowing each pet individually, the time that we take with them through the consultation, plus the process afterwards, we spend hours researching on these pets, and we look at all the supplements they're on, plus the diet, plus the environment. We take this whole big puzzle, we put all these pieces together to make one puzzle that's not a puzzle anymore, because now it's a picture. We make one picture, and we can tailor those supplements and that diet to your pet's specific needs. I would say that there's not one pet that I've worked with that I've done the same thing for once. And
no,
let me tell you, if your pet is diagnosed with kidney disease, for example, the standard of care in veterinary services will be the same. Am I wrong?
No. And it depends. And that's something else, because we look at the blood work, we look at trends. So to be able to see even a couple of years prior, if you have any blood work coming in, that helps us. But some pets are at a certain level that may appear too high or too low, but for that pet, that's normal. Right. So those are things that we like to talk with our clients about. Don't panic, because just as with us people, we're all different and individual, and that pet may feel well and be acting just fine and not having any issues. But those are the things, that we look at and tailor everything specifically.
Yeah, absolutely. So we have one question. I might need some clarification though. So Corinna, I hope I pronounced that, says, hello ladies, my fur babies just came up with anal glands. I'm guessing, are they impacted? Are they itchy? Are they scooting? I set off for an allergy test to start. So great question. If you can clarify for us in the comments what's going on with that so we can give a little bit better guidance and answer.
Currently feeding.
That would be one of the first questions for you is what are you feeding this little one? And that brings us to another important point, which is Sandy and I and the other holistic pet health coaches all have amazing resources for food intolerance testing. We very often use Glacier Peaks. That's a test that can look at both environmental intolerances, if there's grasses or fumes or cleaning products, it can pick up some of those, as well as if there's foods that your pet is eating on the regular or has been exposed to that are a trigger for them. These triggers, if they have a food intolerance, it usually is indicative of some level of inflammation. And when we pull those triggers out for a little while and heal the body, put on a rotational diet where we're rotating proteins, a lot of these issues can be resolved. At least that's what I've seen.
Absolutely. I think with anal glands, a lot of it depending on what they're eating, because if
She says they have to be extracted.
Okay. If you've got enough of the right veggies in there and you get that dialed in, it helps a lot. That little dog that we were talking about earlier, she had to go every month to get her anal glands expressed. And she scooted nonstop and was just horribly uncomfortable. And once we switched her to fresh food, she has not once had to go and have them done.
Yeah.
And it's been well over a year. So that also speaks to what the diet, it can help other things besides the inflammation and weight and things like that. But look at all of that.
Yeah. And to add on to that, moisture content is very important in our pets' food. It's probably the most important for cats because they don't have a thirst drive. They get all of their hydration mostly from what they eat. And if they are drinking a lot of water outside of what they eat, that can be a heads up that maybe something's going on with kidneys or thyroid. And it's always a good idea to get it checked. But when it comes to moisture, having to do with anal glands and having to do with how the stool is formed, because if the stool is the right consistency, then the anal glands should naturally express. There are sometimes they can get inflamed when there's higher histamines going on, or if there's an allergy. So you're on the right track there when getting an allergy test, because there may be a trigger that is causing overall inflammation. And the anal glands also have the same cells as skin. So going back to immune system, and if we've got a gut issue and the first place we see it is the skin, so anal glands can be included in that. It's good to take a check and see what's going on. Sandy, what else do you want to add about what have we, I feel like we've covered a lot, but what else would you like to add about the value that having a holistic pet health coach can bring to your life?
I think one of the things that I have clients say to me a lot is that we are so much easier to reach out to sometimes if they want to make an appointment with their vet. And even if it's not necessarily a serious issue that they need to see urgently, but if they have a question or something, it can take weeks or a month or more to get in. We're generally a lot quicker than that, and we can at least help alleviate some questions or help you determine, do you really need to get in and see the vet sooner? Is it an emergency? So I think that we're very handy in the aspect that we aren't crazy, and I'm not going to say busy because we are, but our schedule is just a little bit different than the vet's office. And those guys are so overwhelmed and they have so many people to try to fit in that I think that's one of the major bonuses is that we're available more readily. And there's a lot of us out there now.
So here's agree. So talking a little bit about the state of veterinary care, I give the statistic, I think, on almost every coach's collab because it's so blaring to me and I feel like it's a whopper. The estimate is that there's 80 million pets in this country and only 75,000 vets. So it's crazy. We're dealing with a giant shortfall here. And part of what we like to do when we're working with pets and their parents is education. So that if there's little things coming up like vomiting and diarrhea. So you wake up and your little pumpkin has decided to have an accident and has vomiting and diarrhea. Does that mean that you automatically need to rush to the vet or rush to the emergency? Probably not. But usually, if you would go to the vet, the standard would be okay, let's see if probably a metronidazole, an antibiotic, an intestinal antibiotic, if there's any diarrhea, when we don't know for sure what's going on. Our little pets, they can get into things, they can eat something funny, they can have little viral upsets in their tummy, and these things happen. And we can guide you towards the steps that you can take if this does happen until it resolves. But of course, if it goes on for, I always say if that's going on for more than a couple of days, it's always a great idea to get checked out by a vet. Yes, but bland diet and a little slippery elm can go a long way. And I think that's something that most pet parents may or may not be familiar with, some of the things that they can do at home. Once again, save them a vet trip and to help these little ones heal if they have something like that going on.
Just providing the education and support and empowering pet parents to be able to do more for themselves. I know that has been one of the greatest things that I'm thankful for doing Dr. Ruth's course, is that I did so much research online and I read things, and you're always a little cautious who's right, this person or that vet or whatever. But once you start to educate yourself and you are confident in the fact that you are able to make a decision, you are not a vet, no, even for my own pets, but at least knowing when it's important to go and to have some tools in our tool bag that can help us out so we maybe don't have to run to the vet.
Yeah. Yeah. I feel so lucky to know all of you and to have been through Dr. Ruth's program. She is an amazing resource, the original holistic pet health coach. And I just can't say enough about her vision, because she saw and she recognized that we had this veterinary shortfall, that vets are not and do not have the time to, if they've got 15 minutes appointments, to jump in and check everything that might be going on. And their training, their medical training and prescribing medications, it's much different than ours. So going forward, when we're spending usually 30 to 45 minutes in a Zoom consultation, and then it doesn't end there. Then with that, most pet parents get a health plan that outlines a diet tailored and the supplements tailored and all those things. I always like to say we're definitely not getting paid by the hour.
No, definitely not.
There's a lot of bang for your buck when it comes to holistic pet health coaches, I think.
No, I do too. And I think honestly, some of the more challenging cases that we have are super fascinating to us. And we love to research and learn more. It's just, I don't know. I still find it fascinating. I love animals and I love to help people. And more than anything, I just love that we can help them because they can't speak up. They can't tell us, just like you said, when Darla had bleeding ulcers, for goodness sakes, she had to have felt so awful.
Yeah. Yeah, she did. Her little pumpkin. Yeah. I was just thinking about her for a minute. So I had my brain like takes a dump, just how far we've come. And I'm so grateful for it. I know that you've had similar experiences with that.
Yeah. Ultimately, we all want to have as much time as we can with our pets, and we would give anything to extend that. And so, by just helping support their body, their nervous system, and every bit about them, we can help do that. And so, whether you're lucky enough to get a young pup and you want to start them off on whole healthy diet in the beginning, and as the new research shows that you may be able to extend their life 2.5 to 3 years, that would be amazing. We all know I recently lost one of my heart dogs, and I would have given anything to have an extra couple of years with her. We're very blessed that we did get 13.5 years, but honestly, I would love to keep them forever.
Yeah.
We can't.
That's the tough part. Although we can't keep them forever, we can give them the very best while they are here because they give us so much. My heart is full every day being surrounded by pets and getting to help other people's pets. And speaking of holistic pet health coaches. I want to give a reminder that Sandy is with Enlightened Mutt. There is a link to her website in the comments. Please check that out. Also, there is a link to Dr. Ruth Roberts' Find a Coach site, and you can take a look at the different coaches there. We all have different talents. We all have different things to offer. A lot of us have a niche, whether it's GI health. Excuse me. I've been working on this like little cough in the background. So I'm sorry. I don't know what's going on there. I might have to just give you like a heads up and you talk for a minute. Sorry about that. So check it out. Sandy's got a different niche of things that she focuses on, as do I, as from cancer to bladder to kidney to liver to orthopedics and joints and all this stuff. There's lots of different things, but we have an exciting thing coming up. We're going to transition a little bit to we've got the Know Better, Do Better event coming up in Chicago. Speaking of Dr. Ruth Roberts, and she's heading up this event, and Sandy is going.
I'm so excited. I hope there's going to be a lot of pet parents that want to come out and learn more and meet a bunch of us coaches. I don't know what the number is at today's count, but there's going to be quite a few coming out to meet everybody and talk about what we do and learn more.
I think there's 20 to 30 coaches. Mm-hmm. That are coming so far. And what is going to, can you tell us a little bit more about what's going to be happening at this event? Why I drink water.
I don't have the list in front of me, so I can ad lib a little bit here.
No, I can help. So it is going to be so it's Know Better, Do Better. It's sessions in canine longevity. So we're going to have Dr. Ruth Roberts around along with some other vets and one of our own, Beth and Claire. I said it right. Hearn Shar, sorry, Beth, is going to be there teaching first aid and CPR. So lots of cool things going on. There's a link in the comments to where you can get tickets. They are $29.99, and we're still under the first 100 tickets. So first 100 tickets, everyone, you get a swag bag. And I was talking to the program director, Delora DeVore, this morning, and those swag bags are going to be pretty awesome.
I'm excited to see what's in them.
I don't know if I can give it away. Can I give it away? I know there's some good stuff in there. It's way more than the ticket price. Way more.
Wait, you didn't say the tickets, all the proceeds go to the Senior Dog Rescue.
Yes. Thank you for saying that. All the proceeds going to Senior Dog Rescue. And then Dr. Sutter is going to be there, and she's got her book is going to be there. And also the proceeds on that are going to be going to a Senior Dog Rescue, in light that the whole thing is on canine longevity. So focusing a little bit at the seniors. Oh, okay. So let's see here. Can we hint at a couple? Yeah, why not? We can.
You don't have to give it all away.
May or may not be some amazing Gussie's Gut around in there somewhere.
Right? Maybe you can just tell who the other sponsors are that we'll be adding to the swag bag.
I don't know if I've got that list in front of me either. Let's see here. Our sponsors, though, and they may or may not have things in this swag bag. Gussie's Gut, Standard Process, Pups Pet Club. I'm reading all off of this right now. Dr. Ruth, of course, Real Mushrooms, Goodness Gracious, and Animal Biome.
Oh, it's going to be great. I'm excited.
Yeah. So it is going to be very exciting. Oh, yeah. Okay. Liz is trying to get them in there for us. I feel like we need to do a live when you guys are there. I don't know if that's going to happen, but I have to live vicariously through you because I'm so sad that I'm not going.
Isn't that when you'll be out of the country?
No, because it's let's see, the event is, geez Louise, I'm getting it together here.
We could pop on live.
It is September 8th, so I won't be gone yet.
We could do a pop on live and walk around and say hi, probably.
Yeah.
That'd be fun.
Yeah. Thank you for putting that in there. All the dates that I'm looking around for. I have the flyer right in front of me, but I can't switch screens me and my techiness. Today it's the cough, my lack of tech skills. But the great thing is that you jumped in, so I'm really happy about that.
I'm always happy to talk with you.
And what's my favorite thing, but because you were so sweet as to jump in here with me and not let me talk by myself the whole time, although I can, I think people get over listening to me. I will let you out of the pet perks and pet peeves unless you really want to do it. You've already done it.
I have done it, yeah. And I
Yeah.
don't know if I have anything new to add.
No, I liked your pet perks and pet peeves. So we'll just leave it out.
Okay.
That's okay. We went through all other good stuff. Okay. So everyone, as we're wrapping this up, this is the last call for questions on this lovely Friday.
And if you're near Chicago, look it up. Come see us next weekend. We'd love to say hi.
Yes. Everybody on or near Chicago, pet health coaches, if you're on the fence, it is going to be an amazing event. I'm just going to be there with you all in spirit. I'm so excited thinking about you guys being there and all the amazing information you're going to have. And yeah, Chicago, big heads up because it's going to be great and lots of info. So Sandy, what's on your pet health coaching to-do list today?
I have a new client call today, and I have 2 health plans to work on. So that's what my afternoon looks like. And I've already I tried your cat treat recipe today for my son's cats, but my dog smells the sardines and has not shut up for the last hour and a half. So I'll drop those off later tonight. We'll see how his cats like them.
Yeah, she's, I don't know why this is still going, but she's talking about Melissa Sherman, who's a colleague of ours with Calming Creek. She has a great cat treat recipe, and that's available on her website if you want to see. Sandy, thank you again. Thanks everyone who joined and who gave questions and support. I so appreciate you jumping in.
Anytime.
It ended up being fun. This is what we always say at the Coaches Collab. It's real talk about real pets and our real reasons. And we were all real today.
Absolutely.
No
Have a great, safe weekend, everybody.
Yes, thanks for joining. Have a wonderful weekend. And as always, positive vibes.
Bye.